Raise your right hand and be sworn.
Do you swear to tell the truth, so help you God? Do.
Judge, at some point I had 3 photographs that were sent out. I don't think what is these.
They're right there.
Okay.
Good morning, Dr. Carney.
Good morning.
Could you please state your full name for the record?
Yes, it's Erin, E-R-I-N, last name Carney, C-A-R-N-E-Y.
And Dr. Carney, where are you employed and what is your position?
I work at the Center for Forensic Medicine. We serve as the Davidson County Medical Examiner's Office and the Regional Forensic Center for Middle Tennessee, and I'm a forensic pathologist.
And what is your current position?
I am the Interim Chief Medical Examiner for Davidson County.
And how long have you worked at the Medical Examiner's Office?
Been there, it'll be 13 years next week.
And prior to that, what did you do?
So prior to that, I did my education and training to become a forensic pathologist. I earned my Bachelor of Science degree in biology with a concentration in biochemistry and cellular and molecular biology at the University of Tennessee, Knoxville. I attended Vanderbilt University School of Medicine, where I earned my Doctor of Medicine degree. I completed residency in anatomic and clinical pathology at the Johns Hopkins Hospital and a forensic pathology fellowship at the State of Maryland Office of the Chief Medical Examiner.
And do you hold any certifications or medical licenses?
So I have medical licenses in the states of Tennessee, Texas, and Kansas, and I am board certified in anatomic, clinical, and forensic pathology.
And can you describe, do you do any teaching in the field?
Yes, so we teach residents in pathology who rotate through our office, and I am an assistant professor at Vanderbilt.
And approximately, can you estimate how many autopsies have you performed in your 13 years at the medical examiner's office?
I've performed over 3,000 autopsies.
And that's you yourself?
Yes.
And Your Honor, if I can pass the witness the document.
Okay.
Dr. Carney, do you recognize that document?
Yes, ma'am.
And is that a copy of your CV?
Yes, ma'am.
Your Honor, at this time, I'm going to ask that that be made the next numbered exhibit, which I believe is number 30.
Okay.
Dr. Carney, can you describe what is an autopsy? What is that process?
So an autopsy is an examination of the body that consists of 2 parts. There's an external examination and an internal examination. For the external examination, I'm looking at the outside of the body. We will record the length of the body on the table to estimate their height in life, look at the hair color, the eye color, and I'll look for evidence of disease or injury that would help me understand why this person died. Then we'll do an internal examination that starts with a Y incision on the chest and abdomen, where we reflect the skin and soft tissue so I can see the ribs, look for any rib fractures. We'll cut through those ribs and take off that sternum and ribs, the chest plate, if you will, so I can see the internal organs and look for any bleeding or fluids around those organs, maybe that shouldn't be there. And then I'll look carefully at each of the organs for evidence of disease or injury. And then finally, we do an incision behind the ears, across the top of the head, and reflect the scalp forward, and that way I can look for any bruising that might be hard to see if we have a lot of hair. And then we'll actually cut through the skull, and that way I can look at the brain and look for any evidence of stroke or bleeding in the brain.
And when you're completing an autopsy, what is kind of the ultimate determination that you are making as a medical examiner?
So the goal of the autopsy is to determine the cause of death.
And obviously there's many causes of death. Is there another determination that you assess?
Yes, so I'll want to determine the cause of death from autopsy. And then from the autopsy findings, in combination with the investigation into the circumstances surrounding the death, I will come to a conclusion for the manner of death. That's a classification of death, and it typically fits into one of 5 categories. There's 6 on the death certificate because there's a pending option if we're still waiting on information.
And that determination of manner of death, is that for purposes of the death certificate?
Yes, ma'am.
Is it a legal determination that has anything to do with this criminal process?
No, ma'am.
And what are the 5, or you said actually 6, possible outcomes as to the manner of death?
So it's homicide, suicide, accident, natural, could not be determined, and then the 6th one, like I mentioned, is the pending investigation. So if I don't have all the information yet to make the determination in one of those 5, then they'll get a pending death certificate until I have everything.
And that is a separate standard that you use just for the death certificate, is that correct?
Yes, ma'am.
So if you labeled something a homicide, it would not mean that a criminal homicide occurred, is that right?
Correct.
And many times it could not be determined from your perspective for purposes of the death certificate.
Yes.
But you still come to court and testify in criminal cases, even in that situation, is that correct?
That's correct.
And did you perform the autopsy of Jade Benning on March 7th of 2023?
Yes, I did.
And at this time, I would proffer Dr. Carney as an expert in forensic pathology.
Okay. Are you again, ladies and gentlemen, Dr. Carney will be allowed to testify as an expert in that field and give her opinion that a lay witness wouldn't be allowed to give. You could place such weight upon her testimony as you choose to. Okay.
And at this time, I would ask that the witness be handed a document.
Dr. Carney, did you complete a report of the autopsy that you completed on Jade Benning?
Yes, ma'am.
Would you have that report? You can take a look at it and recognize it.
Yes, this is my autopsy report with the attached toxicology report.
Dr. Carney, how did you first get notified of Jade Benning? Was it when she was received by your office at the medical examiner?
Objection, Your Honor, leading.
Okay. The question was, when did you get notified about the death of Jade Benning?
Well, my office was called actually a few days after she went into the hospital because she had experienced this anoxic brain injury and it was believed that her death was imminent.
Is that a typical thing that happens?
Yes.
And once you were contacted, did you engage in discussions with people at Vanderbilt?
Yes.
And specifically, who were you speaking to at Vanderbilt?
I had a lot of dialogue with the toxicologist at Vanderbilt because initially Ms. Benning's reason for her brain to be deprived of oxygen, the reason that her heart stopped, was unknown. And so there was a lot of testing and trying to determine why this happened. And so we were in discussion trying to determine what might be her cause of death and what I might need to test for or look for when she came to my office.
And did you actually make requests related to Jade Benning before her body ever arrived at your office?
Yes. So when we are notified that a death is imminent and they're in the hospital for an extended period, and I think the toxicology could be very important in the case, then we want to make sure that that initial blood sample that was taken when they first came to the hospital is saved and not discarded. So we contacted the laboratory at Vanderbilt Hospital to make sure that they saved that blood for me to be able to test after her death was pronounced.
And Your Honor, I'm going to ask that the witness be handed Exhibit 12, which I have, as well as 3 other photographs. Dr. Carney, do you recognize the image in Exhibit 12?
Yes, ma'am.
And can you describe what is that in that image?
So this is the hospital blood, the sample that I mentioned that was taken when she first arrived at the hospital that we asked them to save in the laboratory for us to pick up after she passed away. And this is that blood sample.
Your Honor, may I display this exhibit to the jury? I have it digitally.
Okay. And that exhibit has been talked about before. The photo, who made that?
Who made this photo? The photographer at my office took this picture. This was when the blood sample was transported to the medical examiner's office.
And Dr. Carney, does this have the specific date and time the blood sample was collected from Ms. Jade Benning?
Yes, ma'am. So you can see on the label, it says 2/25/23 at 22:31, so 10:31 that evening.
And is there a Vanderbilt University medical record number also on that same label?
Yes.
And I guess, can you describe, does it have Ms. Benning's date of birth?
Yes. So her date of birth is listed there at the top of the sample. It's upside down in this picture, but yes.
And the labeling underneath it, can you describe what that is?
So whenever an individual comes to my office, they are given their own unique medical examiner case number. So the MEC number 23-0842 is Ms. Benning's specific case number. And then the date underneath it is the date that she died.
Your Honor, at this time, I would ask that Exhibit 12, which was previously marked only for identification, be entered as Exhibit 12.
Okay.
Yeah, may I object and may I approach?
Okay. All right.
Dr. Carney, did you also have 3 additional photos? Do you recognize those?
Yes, ma'am.
And can you explain, when did you receive the blood sample on the one from 2/25/23 at 22:31? When did you receive that?
So that blood was actually transported to the medical examiner's office along with Ms. Benning's body on March 7th in the early hours of the morning.
And you said that it was photographed at your office, is that correct?
That's correct.
And then what, if anything, did you do with that vial of blood?
So I wanted to see what kind of tube it was in and how much blood was there so that I could determine what kind of testing I could order on it. And then I sent it to NMS Labs for the needed toxicology testing.
And can you explain what you mean by you wanted to see what type of tube it was in?
Well, typically when we draw blood at the time of autopsy, we put blood into a tube that has a gray top. It contains sodium fluoride, which is important to inactivate those esterases in the blood. It's these enzymes that can break down cocaine. And so they continue working even after death. And so I wanted to see what kind of tube it was. This is actually a clear top tube, so those esterases are still able to break down the cocaine. But just so I'm aware, and that way I order the correct testing so that I can not only see if there's cocaine there, but if there's those breakdown products that have probably been formed over the time that it's been in this tube in the hospital.
And Dr. Carney, can you explain why was it that you were wanting to have it tested for cocaine?
It was, I learned in the process of while Miss Benning was still in the hospital that she had a urine drug screen that was positive for cocaine.
And so once you received that file, did your office submit a request to NMS?
Yes, ma'am.
And can you explain what is NMS Labs?
So NMS is a toxicology laboratory that is located in Pennsylvania, and they have a lot of capacity for testing, and so we send our specimens to them.
And did you send that specimen to them for testing?
Yes, ma'am.
And did they report the testing results to you?
Yes.
And then what, if anything, happened with the blood from Jade Benning from 2/25/23 to 22/31?
So when they were done with testing, they sent me a laboratory report with the results. I actually ended up talking to a toxicologist at NMS, and I let them know, typically they hold the blood for 1 year and then they discard it. So I let them know I did not want them to discard this, and then before that year was up and time to discard, I asked them to transport it back to my laboratory so that we could preserve it.
And do you recognize what is in those 3 photographs?
Yes.
And what is that?
So this is that same tube of blood that I asked them to send back to our office, and now it has their case label on it.
Your Honor, at this time, I would ask that those 3 photographs be entered as the next numbered exhibit, which I believe is 31.
Sure.
May we approach Your Honor?
Okay. What do you want? Okay. All right, show those 31.
And Your Honor, may I have permission to publish the photographs
For exhibit 31 to the jury.
Okay, you need these?
Yep.
Okay.
Dr. Carney, can you see the image that is on the screen?
Yes, ma'am.
And can you describe what's in the image and how you were able to identify it?
So if you see on the tube, it has the case ID, which is her unique medical examiner case number and her name. And then the label at the bottom is one that we printed at my office to take the picture.
And the next image, which is 31B, can you describe what is shown here?
So here we have a barcode and we have a series of numbers that 231-26889 number, that is the unique work order number that is attached to her laboratory report, her results.
And if you need to reference your autopsy report, do you recognize that work order number from NMS?
Yes, and even the 001 identifies it as the hospital blood for this particular case.
And can you, just for the record, read out what the work order number is and verify that it's the same in your autopsy report?
Yes, ma'am. 231-26889, which is the work order on the report as well.
And the next image, which is Exhibit 31C, can you describe what's shown here?
So this again confirms this is her hospital blood. It shows the date that we entered the order into the computer, and then the date, it looks like the date they received it. So we didn't ship it out the day that we ordered it. We usually send it out twice a week. So it got sent out likely on the 3rd for overnight shipping for them to have it first thing in the morning. And it's sent with cold packs to keep it in the best quality.
And where is that tube of blood now?
It is at my office.
And it is still at your office, is that correct?
That's correct.
Dr. Carney, when the blood was sent out, did you receive a report from NMS Labs?
I did.
And specifically, can you describe what was the testing that you requested and what was the testing that was done as it relates to that 225-23-22-31 hospital blood?
So I ordered a cocaine and products panel so I could catch not only the cocaine, but any breakdown products that may have formed while it was sitting in that tube. And then I also asked them to test for designer opioids.
Your Honor, at this time, I'm going to ask that Dr. Carney's autopsy report be made the next numbered exhibit. I don't believe that I entered it.
No objection.
Okay.
You have a copy.
Yes, ma'am.
No objections outside of the standing objections.
Okay.
Dr. Carney, your autopsy report, which is now Exhibit 32, did you incorporate the NMS lab work order number 231268889 as part of your report?
Yes, I did.
And did you rely on these findings in making your determination as to the cause of death?
Yes, ma'am.
Your Honor, may I publish a page from Dr. Carney's autopsy report to the jury that is part of Exhibit 32?
Okay.
Dr. Carney, can you describe what is shown here on the screen?
This is the front page of the toxicology report, and this shows the positive findings, the testing that I requested, and the specimens that they received. And it also has her identifying information up in the right-hand corner.
And this next image is kind of a zoomed-in image. Can you describe what was the testing that you requested as it related to just the item 001 hospital blood?
So if you see under testing requested, I asked for the 1303B test, which is cocaine and products panel on the blood, and then the 1480B designer opioids on the blood.
And going to just that first blood sample from the 225-23 at 22-31, can you describe the toxicology results and kind of what those results mean? What is the result related to cocaine with the result of 78?
So this is the actual parent drug, cocaine, that was present at 78 nanograms per milliliter in the blood.
And can you describe what that means of parent cocaine? When someone ingests cocaine, are there things that happen within your body, and are there other substances that are created?
Yes, so the body, you'll absorb the cocaine and have this parent drug, cocaine, in the blood. And then, like I mentioned, the enzymes will break it down, and so you have breakdown products. So these other two that are listed, the benzoylecgonine and the ecgonine methyl ester, are the breakdown products.
And can you describe the difference between the two?
So you typically don't see a large amount of ecgonine methyl ester circulating in a live person's blood, but it very well can form post-mortem in a tube of blood or even in the body as the blood sits there and they're awaiting to have their blood drawn, for example, at an autopsy. So when we look at these breakdown products in the autopsy setting, this ecgonine methyl ester was likely parent cocaine at the time of the person's blood draw.
Your Honor,
But it's,
I would object to this witness testifying to things that relate to toxicology as opposed to a pathologist, as she has not been qualified as an expert on toxicology.
Okay, do you want to ask whether she can, from her experience, make that connection?
Yes, Your Honor, I'm happy to. Dr. Carney, do you have training and experience in toxicology and interpreting these findings because it is required for you to determine a cause of death?
yes, ma'am. That's part of my job, is to take toxicology results in the autopsy setting and apply them and determine a cause of death.
Do you perform autopsies where the outcome of the circumstances is the person overdosed on narcotics?
Yes.
And so is this something that you do on a regular basis?
Yes, ma'am.
Are you extremely familiar with the topic that you were speaking about?
Yes.
All right, I'll overrule the objection. Go
May I take
ahead.
the witness on word item?
I'll over the objection. Go ahead.
If you could continue, you were explaining that the ecgonine methyl ester, that it was most likely the parent cocaine. Can you describe what you mean by that?
So like I mentioned, this cocaine is about the only drug that does this, where the enzymes in the blood can continue to break it down after death. Most everything else relies on being circulated through the liver, and really nothing changes after death as far as if you get them to autopsy soon after death. In this case, the ecgonine methyl ester has formed because the esterase is in that clear top tube that didn't have the preservative to stop the breakdown, has broken down the cocaine into ecgonine methyl ester. So if you add the cocaine number and the ecgonine methyl ester number together, that will give us an idea of how much cocaine was in her blood at that point in time on February 25th, 2023 at 22:31.
And so is it your testimony that that amount would be 7,878 nanograms per milliliter?
Yes, ma'am.
So that would be the concentration of cocaine in Jade Benning's blood on February 25th, 2023 at 22:31 p.m.
Yes, ma'am.
Dr. Carney, you've already testified that you have performed autopsies where someone has overdosed. Can you describe, is that amount of cocaine in a person's blood, is that common?
No.
And so when you first got this case, you said you were talking to Dr. Bertolari, is that correct?
Correct.
Did people from my office, including myself, meet with you kind of early in the process, specifically about these toxicology results?
Yes.
And at that time when we met, had you ever seen an amount that high in an autopsy?
No.
And did you, I guess, go back and look at other autopsies that were done in your office?
I look primarily at my cases because I'm familiar with those. I've interpreted those. And that was almost 300 cases that I signed out, the cause of death or contributory cause of death, including the drug cocaine.
And in that first time that we met, had you ever seen anything close to that level?
I could not recall anything this high.
What would a typical level be in a overdose where it's just cocaine, no other substances, that you were familiar with from your 300 cases?
So I went back over the acute cocaine intoxications, and they're pretty much all under 1,000 nanograms per milliliter. 2 or 3 were in the 1,000 to 2,000 range.
And since that first meeting that we have, did you do another review looking for anything that compared to this particular result?
I did go back through looking at all of my acute cocaine intoxications, really trying to look at those carefully. I even looked at dozens of the ones that had cocaine plus other drugs involved.
And did you find anything that was similar to that amount of 78 nanograms per milliliter?
I found one.
And can you describe what was the result in the one case that you found?
The cocaine level was 10,000 nanograms per milliliter in the blood.
And going back to the ones that you had done that you initially reviewed where 1,000 was the highest, can you describe what were the findings in your autopsies of the method of ingestion?
So a lot of these we do have scene investigations. They look for drug paraphernalia, and in many of those you would find evidence that the person smoked it, or perhaps we would call it nasal insufflation or snorting it, or intravenous injection if they were able to put it in a syringe and inject it into the veins.
Had you ever, I guess, done an autopsy before where oral ingestion was the method?
It's very uncommon, and I did not recall cocaine ingestion being a common method of administration.
And that one case that you found that the medical examiner's office and autopsy was performed, what was the method, or can you just describe the circumstances of that particular case?
That one was believed to be ingestion. It was someone who had been taken into custody, was believed to have swallowed something while in intake at the detention center, and then died during the booking process.
And when you say died during the booking process, what was the amount of time? And you said they ingested it. How did they ingest it?
Swallowed.
So as an oral ingestion, do you know an approximate time frame?
I don't, but it did not sound like it was a very long period of time.
So something that happened fairly quickly, comparatively speaking.
Yes, ma'am.
And in that autopsy, I guess, are you familiar with autopsies where there's been other oral ingestions of cocaine?
I did have another one with oral ingestion of cocaine, but it was mixed with another drug. And we knew that it was oral ingestion because I found the bag with the crystalline substance that had broken open that was still in the stomach.
And typically, what is the result going to be for cocaine in a case like that where someone swallowed a balloon? Have you looked at any data related to that?
Yes. So in the literature, it shows that those are the cases where they swallow cocaine in an attempt to transport it somewhere internally, not to use it for its effects, or they swallow it to avoid perhaps being caught with it. In those cases, the cocaine level is high.
Is it as high as the 78 or the 10,000 in the other case?
Yes.
And specifically that case with the 10,000, in that autopsy, was there a bag found?
No.
And can you describe what would the bag potentially have to do with what the cocaine level would ultimately be?
Well, if you have a bag or some sort of protective covering, then that's going to delay the time because then the acid in your stomach has to kind of break through that bag in order to get to the drug. So it should delay it.
And can you describe what information did you have about the method of ingestion related to Jade Benning and the subsequent cocaine testing?
I found from the police investigation there was concern that she may have ingested it by drinking it.
And are you familiar with the additional testing from NMS Labs, specifically of the substance on the comforter?
Yes.
Objection, Your Honor.
What's your objection?
The line of questioning that she's going into in regards to any findings on that comforter at this stage.
Okay, do you care to be heard?
Yes, Your Honor. I'm asking her for...
She factored in something from further test on the comforter?
Correct, Your Honor.
Okay. All right, let the lawyer look at it.
Familiar with Dr. Midden's testing of the pink substance on the comforter. Can you describe when you're making your determination for cause of death, are you considering other testing that's done, things from the scene? What do you consider?
So forensic pathologists don't work in a vacuum. We do need that information from the scene, from the police investigation, so that way we can appropriately direct our testing, especially in a case like this when I don't have a lot of admission blood to work with. So we do look at that in totality.
And can you describe what information did you have? Did you make a determination as to how Ms. Benning ingested the cocaine that resulted in that toxicology report?
Well, yes. So based on the high level of cocaine, and knowing even from the literature, from the toxicology textbook, that you really see this in an oral ingestion, which is consistent with the investigation. I actually signed her death certificate to say ingested cocaine.
And going back to kind of the toxicology, when you're looking at you said ingestion and levels, are there any studies that you sometimes reference to make a determination about maybe when this substance was ingested compared to when the level of the toxicology report is done?
Yes, so there are studies, and they've kind of pulled everything together, even in our toxicology textbook, that looks at the time frame from the time that it was taken into the body by whatever method, and the kind of high level, the peak level is found.
And in those studies, I guess, can you describe what do you mean by peak level?
Well, in the study scenario, when you're actually administering cocaine to a volunteer, you can draw their blood serially and look and see how the levels, how the numbers change to try to determine how high are they going to go and at what point do they get there. So, and they've done those sorts of studies with low levels of cocaine.
And is that those types of studies, are they looking at the half-life of cocaine or whatever the substance is?
They are. So they look at how quickly it shows up in the blood, what the numbers are, and then how long it takes for the parent cocaine to be broken down into those breakdown products, including that inactive metabolite benzoyl that you see.
And you referenced the studies that they were giving test subjects cocaine. What form of cocaine are given in those studies?
So there was one that I found that was, for the oral ingestion, it was a capsule form, and it was, I believe, 100 and 200 milligram capsules.
in those studies where we have this capsule,
Mhm.
are the peak levels anywhere near as high as Benny's?
No.
Can you explain what would happen if they were?
They would be deceased.
And looking at those studies, which obviously you've explained, it's a capsule, it's a low dose, what is the peak time generally?
So usually for those, the oral ingestion takes a while. I mean, the absorption from oral ingestion takes a while, so like 45 minutes to an hour. Now, they did have one where they looked in this country, ingestion is not a common thing, but in other countries, they may be able to chew those powdered coca leaves, and then they looked at those individuals with those low levels of cocaine chewing the leaves, and they saw the levels peaking at 24 minutes to an hour or two. And that's not in the capsule form.
And you said for the capsule, 45 minutes to an hour was kind of common.
Yes.
Are there any studies on anyone ingesting liquid cocaine?
No, not that I'm aware of.
Is it possible to liquefy cocaine?
Sure.
And kind of comparatively speaking, those studies with the capsules, you can't really relate it to a liquid cocaine. It's different. Is that correct?
That's correct, because liquid medications are absorbed more quickly than a capsule or a hard, like, tablet form.
And the testing that we have from 225, 23, and 2231, where Ms. Benning's cocaine concentration was 78 nanograms per milliliter, are you able to say if that is a peak level?
No, that's what it was when she came into the hospital and they drew her blood, but I don't know if that's as high as she would have gone had she continued to live, or if she had already peaked. I really don't know. That's what we have at this point in time. I don't have subsequent blood samples to compare.
So any of those studies, they're not really comparing the two same things, correct?
Correct.
And can you go through and describe the autopsy of Ms. Benning and what your findings were, and explain the cause of death?
Yes. So Ms. Benning came to my office and I examined her body. I found that, like I mentioned before, she had the period of time where she didn't have a pulse and she wasn't able to supply her brain with enough oxygen. So she had what we would call an anoxic brain injury. When the brain is injured, it does one of two things. It bleeds or swells. It bleeds typically if it's been injured, like by blunt force injury or gunshot wound. And if it's not, then it usually swells. So her brain was very swollen. Unfortunately, there's only so much space in the skull for the brain to go. So when it gets really swollen, it pushes down on the bottom of the brain where you control your heartbeat and your breathing. So her brain had actually begun to herniate down out of her skull. So I saw brain swelling, cerebral edema, and herniation. The other things I found is the chambers of her heart were dilated, but her heart was not enlarged. And she was pregnant. So I saw the fetus, a baby girl, approximately 25 weeks gestational age. I examined the baby, and there was no anatomic or congenital malformation with the baby. It looked like a healthy, normal 25-week gestation pregnancy. I also did histology. I took samples from several of her organs, looked very carefully at her heart, even in the conduction system, that electrical system that causes your heart to beat normally, to see if there was anything wrong there, and submitted those. And let's see. I did not find that she had any pneumonia, did not see any infection in her lungs. She had a few heart cells that were a little bigger than normal, but she didn't have any infection. She didn't have a heart attack. I didn't see any inflammation in the placenta or the umbilical cord, any sort of infection that would have hurt the baby. So at the end of all that, and I have these toxicology results, the cause of death I determined was acute cocaine toxicity.
And can you describe, the toxicology results of Ms. Benning? Can you describe, once she ingested that liquid cocaine, what would happen to her body?
So cocaine causes your heart rate to go up, and your heart has to work harder. It actually causes the force of the contractions of the heart to be stronger. It also, unfortunately, clamps down on the blood vessels. It causes them to spasm or constrict. So your heart's working harder, but you're not able to supply it with oxygen as well. And really, it's affecting all of your blood vessels. So it's going to make it harder for you to supply all of your organs and tissues with the oxygen that you need. In some cases where people have used cocaine, they may actually have a heart attack. It can also cause an abnormal rhythm of the heart, particularly if it's high. And that abnormal rhythm, if it can't sustain life, then the person will become unconscious and lose their pulse.
You said that it can cause a heart attack. Did Ms. Benning suffer a heart attack?
No.
And you said that there was no problem with her heart. She had a healthy heart. Is that right?
Right. Well, the chambers were dilated, but the heart itself was not enlarged, and she has no history of any sort of heart problems, congestive heart failure, anything to make me think that that was an issue for her.
Is that something that is common in pregnant women?
It can happen, especially postpartum. They can have issues like that. The blood volume, increases in pregnancy.
But there was nothing unusual about that at all.
It was nothing concerning for a cause of death.
And can you describe if someone ingests liquid cocaine, would they immediately go into cardiac arrest?
Not seconds later. It would take a little bit of time for them to absorb it through the, stomach wall, intestinal wall.
And kind of those first minutes, and I'm talking like maybe 2 to 3 minutes, what would the effects do to the body? Would it make it perfect?
Objection, please.
Right. The question before you kept going was, what would it do to your body?
So, like I mentioned, what cocaine is going to do to the body. It's going to cause the heart rate to go up. It's going to cause the arteries to kind of constrict or be smaller, kind of clamp down, tighten up to where it's harder for the blood to flow through them. But you're going to have to absorb it into your bloodstream in order for it to affect you. So you've got to have time for that absorption. Not long if it's going to be a liquid form, or unencapsulated form.
And would you expect someone to be dizzy?
They can be, yes.
Would you expect them to continue to be able to walk?
You could walk initially, but as the level rises, it's going to affect you more.
And then what about any type of, aspirating or vomiting? Would that be something that you would expect to occur?
That is a common thing to happen in a lot of deaths.
And if someone describes someone as snoring, does that have anything to do with these symptoms?
Snoring often, especially when it's around the time of death, often refers to agonal breathing. So it's kind of that gasping breaths that can sound like snoring.
And agonal breathing, you said it's close to death. Is there any type of time frame that you can give to that?
I'm not sure, but we do hear it very frequently where they'll say someone's snoring and then they stop breathing completely. And it's probably because they were gasping for some period of time and then they stop breathing.
Would the person be able to vomit after that?
Yes. People vomit pretty routinely close to the time of death when they're unconscious. And then that's where we run in with some aspiration issues for people who make it to the hospital and survive for a period of time.
You said the person would be unconscious.
Yes.
And what happens to the body when you have that lack of oxygen to your brain?
That's why her brain is swelling. So once you deprive the brain of oxygen for too long and it can't recover, it will swell. And it'll swell to the point where we have, like in her case, the herniation out of the skull, and it causes their death because it presses on that center that controls your heartbeat and your breathing.
And so you said that the studies that you referenced about oral ingestion, that time frame can't really be compared to this. If you had the circumstances of Miss Benning being able to paint words on a photo at 9:10 p.m. and at 9:24 p.m., she's been painting and the word beautiful is now added to the photograph, it's been painted, the words are legible, you can see them. If that happens between 9:10 and 9:24, and then there's 4 minutes of photographs taken where you can't really tell anything about symptoms, but then 19 minutes from that kind of first painting, she's added words at 9:24, and then at 9:29 p.m., there's a phone call where someone describes Ms. Benning as being able to talk at the beginning of the 6-minute call, but by the end of the 6-minute call, her words do not form and make any sense. And then she is found by EMTs within 20 minutes of that, and she is pulseless. That time frame, is that consistent with her ingesting that cocaine within 30 minutes of her being found pulseless?
Yes, ma'am.
I want to talk about Miss Benning's unborn baby girl. You did an autopsy on the fetus as well, is that correct?
Yes, ma'am.
And can you describe what actually caused Jade Benning's death?
So acute cocaine toxicity caused Miss Benning to die.
So it was the cocaine in and of itself.
Yes.
And she was pregnant.
Yes.
Is there anything about cocaine and pregnant women that is, I guess, something that you know about?
Yes. So cocaine is one of the only drugs that we know can cause pregnancy loss, because it can cause placental abruption, where the placenta pulls away from the uterine wall. That disrupts the blood flow from mom to baby, so now baby's not getting the oxygen that it needs through the blood, and then baby dies.
And did Miss Benning suffer placental abruption?
No.
And I guess why is that?
Well, she died of the cocaine toxicity, and so the abruption maybe didn't have time to occur, or just didn't occur in this case.
And I guess if she maybe had been given less cocaine, is it possible that it could have caused a placental abruption?
It could have.
And this information about cocaine and pregnant women and the cause that it causes placental abruption, are there studies on that?
Oh, yes.
And you said, oh, yes. Can you describe how many studies are there on that?
I don't know how many studies, but they're out there, because that's something that I searched early in my career to learn the connection between drugs and pregnancy loss, and that was one of the clear connections, was cocaine and placental abruption and pregnancy loss.
And are those studies available on the internet?
Yes.
Can you describe, you said that there was no placental abruption to Jade Benning's unborn baby girl. Can you describe the autopsy of her unborn baby?
Yes. All right. So the baby. Sorry, I was looking for the weight here. We have an 830-gram female fetus, and then I have all the measurements listed. We take the weight and the measurements to compare it to a chart to see how far along the pregnancy was, and it fit with a 25-week gestation pregnancy. She was in the uterus, the baby surrounded by amniotic fluid. The amniotic fluid was yellow, but there were green particles in it concerning for meconium, which you typically see when the child is distressed. So the child was under some sort of stress, which means they basically had their first bowel movement in utero. into that amniotic fluid. Then I measured the placenta. I saw a 3-vessel umbilical cord, which is normal. I did not see any adherent coagulated blood on the placenta that you might see with abruption. And I didn't see any evidence of infection, nor did I see any under the microscope. And then I looked at the organs. All the organs were in the right place. The weights were accurate and as expected. No other abnormalities with the child.
If Jade Benning had not ingested the liquid cocaine that she did, which
Objection, Your Honor.
Okay, you want to rephrase your question?
I hadn't finished my question, Your Honor.
She's objecting to
Me asking
the way
her.
you phrased it.
Dr. Carney, if Jade Benning had lived, would you have expected her to have a healthy pregnancy based on your autopsy of her unborn baby?
Yes, ma'am.
Was there anything wrong with her baby?
No.
Would her baby be able to live after ingesting that level of cocaine?
Would the baby be able to live after mother ingested that level of cocaine?
Mother ingested that cocaine, and
Right.
could her baby have lived without her?
Okay, so I understand the question. So the baby died because mother died.
And did you do further testing of anything related to the baby's organs?
Yes, I sent the liver tissue from the fetus for testing.
And can you describe why did you do that?
I was looking for the presence of any sort of drugs that might have circulated through the baby's liver while mom was under the influence of this drug.
And you said that you submitted that liver tissue specifically for testing.
Yes,
And is that result also incorporated in your autopsy report?
yes.
And can you describe what was that result?
So the liver tissue was presumptively positive for fluconazole. That's an antifungal commonly given to women for yeast infections.
And did you have any other information related to the testing of that liver tissue?
There were no other positive findings reported. Based on further investigation, I called and discussed the toxicology findings in this case with a toxicologist at NMS Labs. They said that cocaine was found, it was triggered in the liver tissue, but it was very close to the cutoff limit. So they said if we sent it for confirmation, it might not show as positive because it was so close to the reporting limit, but it was there. And in forensic pathology, we're often interested if a drug is even present. So that's why I asked.
And that liver sample was taken on March 7th, is that correct? The liver tissue?
Yes, ma'am.
And so that would have been 10 days after ingestion.
Yes.
And can you describe what would happen to, I guess you were talking about the ingestion of cocaine, that it clamps down on the blood vessels.
Yes.
That ingestion of cocaine by Jade Benning, what would have been happening to the baby in that moment?
Well, everything that's in mom's blood goes into baby's circulation as well. So clearly the cocaine in her blood did make it into the baby and was still in the liver even 10 days later. Unfortunately, because the cocaine causes that difficulty for the blood to flow to all the organs and tissues, including the uterus and the baby is likely deprived of oxygen during this time. So by the time EMS makes it to Miss Benning, she doesn't have a pulse, so she doesn't have enough of a blood pressure to supply her own brain with oxygen. She's not going to be able to supply the baby with adequate oxygen either, because she doesn't have enough of a blood pressure. They worked very hard to try to save her and took her to the hospital, but they didn't get actual circulation back for some time. I mean, there's I believe a 12-minute gap between the time they left the scene, they get her to the hospital, and at some point after that, they get her circulation back. And my understanding is the first evaluation of the baby, as mentioned in the medical record, is the heart rate was already low. So she had already been deprived of oxygen as well.
And Dr. Carney, you referenced the medical record. Did you review other, records related to the medical health of Ms. Benning as well as her unborn baby?
I did try to obtain as many of the OB records as I could find.
So you had her records from Dr. Mullally and the UMC,
I believe that's where it was, yes.
as well as her Jade Benning's medical records from being in Vanderbilt University Medical Center. Is that correct?
Yes, ma'am.
And you were mentioning the baby's heart rate. Can you describe what happens, medically, what does that mean when a baby has a heart rate as low as Ms. Benning's unborn baby that I believe went down to 30 beats per minute?
It's very concerning because, again, she doesn't have, her heart is responding to not getting enough oxygen. It's not beating normally, because normally the heart rate is much higher. So I know there was a lot of concern that, the baby wasn't getting enough oxygen and was already in the same kind of scenario as mother with that anoxic brain injury.
Is it possible if anyone made a decision to do a cesarean section and take the baby, is it possible the baby would be in the exact same condition as Ms. Benning?
Yes, and then you have also the added challenge of, at that point when she first went into the hospital, the baby was only about 24 weeks, even 25 at autopsy. So at that point, the lungs aren't very well developed, and it's really difficult to oxygenate those little ones and for them to survive.
Thank you, Dr. Kearney. I don't have any other questions.
All right, questions?
Actually, I'm sorry, I did forget to ask something.
Excuse me?
I did forget to ask a question. May I ask?
Okay.
Dr. Kearney, did you determine a manner of death?
Yes,
And what was the manner of death?
could not be determined.
And you did not make a determination on that, correct?
Correct. The circumstances surrounding her ingestion of cocaine were very concerning, that she ingested this unknowingly. Most cocaine intoxication, someone is taking the drug for wanting to get the effects, and so we would call it an accident because they didn't take it to try to kill themselves. In this case, police investigation did not show any history of illicit drug use. Everything that they found that as soon as she found out she was pregnant, she wanted to do everything she could to take care of herself and take care of that baby. And it didn't really fit with your classic using drugs for the euphoric effects and accidental death. It was much more suspicious that someone gave it to her without her knowledge, but it didn't have enough to get to that, homicide determination.
And your autopsy report, that was completed, I believe, August 11th of 2023, is that correct?
That is correct.
Thank you, Dr. Kearney.
Okay.
Good morning.
Good morning.
I have a few questions for you, Dr. Carney.
Okay.
Just so the jury knows, we've met before, correct?
That's correct.
Okay, thank you. Let's talk a little bit first about your qualifications.
Okay.
You are in fact a pathologist medical examiner.
Correct.
And that's what you went to school to learn to do, correct?
Yeah, for my training, yes.
You are not a toxicologist
That's correct.
and have not been to school to become a toxicologist.
That's correct.
You'll agree with me that is a totally different area of expertise.
That's different because that's taking the blood and taking it through the machines and interpreting the data. So that's not what I do.
And it takes a whole nother specialized training to understand the toxicology, let's say, for example, cocaine and the metabolites like the BZE and the MEE, which are the metabolites of cocaine, correct?
It takes training to be able to test for those, interpret them in the data, yes. My training is in taking those toxicology results in the setting of that autopsy. I did actually spend a whole month in the toxicology lab as a resident, and then I rotated again as a forensic pathology fellow so that I could learn how this is done, what's important in the autopsies, and how to interpret them to determine cause of death.
But just so that the jury is clear, that doesn't make you a toxicologist, correct?
That's correct.
And it takes, if we were to ask a toxicologist, if 1 month in a lab is all it takes to be able to become an expert, would they agree or disagree?
Well, I'm not an expert in performing the toxicology. My expertise is in taking those toxicology results in the setting of the autopsy to determine cause of death. A toxicologist will not determine a cause of death.
No, of course not. Tell me exactly then, outside of that month, what other trainings have you had in regards to toxicology?
So in my fellowship and in the 13 years that I've practiced since, it's been my job to take these toxicology results in almost every autopsy I perform and apply those to that case to determine if it is a toxicologic cause of death or not.
But my question was the training. What training, and not on-the-job training in terms of, I have a body in front of me that has toxicology results.
Mm-hmm.
What specific schooling and training do you have outside of that month for toxicology?
Like I said, in your fellowship, you learn how to apply results. You have attending pathologists that you can ask questions of. There's toxicologists to ask questions of. And then you continue to do that in your practice.
So no schooling?
There's no specific schooling for that, no. You don't go to a special set of training in order to learn how to do this as part of forensic pathology. It's part of your forensic pathology training.
I'm speaking about toxicology. That's the question before the jury. Toxicology schooling and training.
But I don't perform the toxicology testing. I take the results and apply them. That's part of forensic pathology training and practice.
And that's a different area of training and schooling as well, to interpret toxicology results, is it not?
And that's what I do. That's what I was trained to do in my forensic pathology fellowship and what I've been doing for years.
Okay. And what school did you go to for that toxicology training?
I went to the State of Maryland Office of the Chief Medical Examiner for my forensic pathology fellowship in which I was trained.
Okay. And you were there though for forensic pathology, not toxicology.
The-
Let's go now
Says she's
to.
gotten training in interpretive toxicology.
Very good. So let's go now to your duties here with Ms. Benning.
Okay.
When did you first learn about this case?
I first learned about the case when she was still in the hospital in the intensive care unit.
And do you remember when that was?
That was February 28th. My office was notified.
Who were you notified by?
The initial note mentions a physician at Vanderbilt, but it did not have a name. Here we go. A physician from Vanderbilt contacted the office, and then we were also called by the toxicologist at Vanderbilt.
Oh, there was a toxicologist that was involved?
Yes,
What was that toxicologist's name?
Dr. Rebecca Bercoleri.
And do you remember the purpose of the call?
The initial call to our office was to let us know that she was expected to die of her anoxic brain injury, and given the case information, that she would be a medical examiner case.
Okay. And so was there anything specific that they needed you to do at that time?
There was a question about whether or not she was a consented organ donor, so there was a question about organ donation.
Were you aware that at some point prior to her coming to your office, and speaking about Ms. Benning, that there was an investigation going on in regards to whether or not she ingested some type of drug?
Yes.
And over the course of that time, did you ever have an opportunity to speak with the homicide detective, Adam Reese?
Yes.
Did you also have an opportunity over the course of that time to speak with General Norman?
Yes, I think I did speak to General Norman during that time frame, or shortly after.
And all of this was prior to Ms. Benning getting to your office,
Correct.
or arriving at your office. Okay. So when Ms. Benning arrived at your office, you performed the autopsy, correct?
That's correct.
And you'll agree with me, I learned very early on, that an autopsy is not done in a vacuum. Have you ever heard that phrase?
Yes.
Can you tell the jury what that means?
Well, it means that we need to know what the circumstances are surrounding the death, because there are some deaths that don't have specific autopsy findings, or they have very few. So we need to know how to interpret that in the setting of the circumstances surrounding death.
And that just basically means you can't, sometimes you just can't look at the body and the body itself
Correct.
in order to determine the manner of death.
Or even, yeah, that's
Okay.
true.
Okay, fair enough. And so would you say then that you would consider Ms. Benning's case one of those cases where you had to look at circumstances outside of the body?
Yes, ma'am.
Now, knowing that you now are looking for a specific drug, perhaps, that there is a homicide investigation going on, what did you do to try to determine what, if any, drugs Ms. Benning would have been involved with?
There was more than one urine drug screen that was performed at the hospital. And there was additional testing done because they were trying to determine at the hospital if there was any drug that she had ingested that they could treat for, maybe understand why she was in the state she was in. So I did talk to the toxicologist about that to find out what had been tested, if anything was positive, what was negative, and that could help me direct the testing on the small amount of blood I had to work with.
So you were looking then for particular drugs based on all of the investigations surrounding this death.
Yes, ma'am.
Did you take a hair sample?
No.
You did not?
Not for toxicology testing, no.
But did you take a hair sample?
Because she's a suspected homicide, there might have been some sort of hair sample collected, but it was not used for toxicology.
May I ask that I pass an exhibit for identification purposes? Would it help you if I showed you a couple of pictures that were a result of your testing and or collection to refresh your memory?
Okay. Yes.
So do you remember taking a hair sample?
Yes, so this is a pretty common practice with a homicide investigation that we would take a hair sample, but it was one that's not used for toxicology testing.
Okay. And did you take fingernail scrapings?
In this case, we did fingernail clippings.
Clippings?
Yes.
So there were no fingernail scrapings?
I don't usually do scrapings. I'll actually clip the whole nail itself, or the end of the nail where you would have the scrapings, and just take the whole thing and put it in the envelope for them to test.
Okay. And did you have, knowing that, because you got the body on March the 7th,
Yes.
and you did not make your findings until August 31st?
Yes. Or August 11th, I believe it
I'm
was.
sorry, August
Yeah.
11th?
Yes.
Okay, so that's 5 months.
Mm-hmm.
And during this 5 months, I think you stated that the matter of death was pending.
Correct.
So you were trying to find what involvement, if any, Ms. Benning would have had with drugs.
Correct.
Okay. And so then did you send that hair sample out to be tested?
No.
Why not?
I don't normally test for hair. That's kind of for long-term things, and usually I think I've only sent hair for heavy metals testing. It's not a common thing that I test for
But you
illicit
can,
drugs.
I apologize.
Sure.
But you can find the different types of drugs that a person may have been involved with, come in contact with, or utilized with the hair sample. Can you not?
It's possible. I've not tested hair for cocaine.
But you can do that, can't you?
I think you can.
You don't?
I'm not sure, I've never done it, so I haven't checked into that.
What about to test the fingernail clippings? Did you have any of that tested?
No, actually, I gave the fingernail clippings, I believe that was picked up by the police department.
Have you ever heard of someone taking cocaine with their finger and doing it like that?
It is possible.
So wouldn't it have been important in trying to determine what happened truthfully to Ms. Benning to have those scrapings tested?
I've never sent clippings for drug testing.
And so you did not do that either?
No.
So you landed on the testing for the blood.
Yes.
And did you try any other means or methods to determine what types of drugs she would have been involved with?
Any other means other
Are
than
there
testing?
any other means that you as a pathologist can engage in to determine what type of drugs that Ms. Benning could have been involved with?
Well, blood is really what we want to know, if there's any drugs there, because that's what's going to be circulating through her system. And we have a peripheral blood sample, which is ideal. So from that, we know what drugs are circulating in her system at the time that she goes into the hospital. There was other testing done, and I did try to gather all of that in order to direct my testing.
What about the vitreous fluid? Did you do that? Or can you educate the jury what the vitreous fluid is?
Vitreous fluid is the fluid of the eyeball, and we do collect that on every autopsy. You can test that for, occasionally I will test it for drugs. Usually I want to use that to look at their electrolytes to see if they were dehydrated, if there's any chance they might have had high blood sugar, or died of, a diabetic crisis. But yes, so we do have vitreous fluid that we draw in each case.
Did you draw that from Ms. Benning in your search for what type of drug she was using?
I believe we did. Verify that. I did not send the vitreous fluid,
Okay, so
but I think we did collect it. Although I wasn't concerned about her hydration levels, considering she'd been in the hospital and that had already been followed.
well, you don't have to look with this.
Right.
Will you agree with me that you can do drug testing with vitreous fluid?
You can.
And sometimes it's the best way to test for different types of substances.
I don't know that I would say the best way, actually. Blood is the best.
Okay. But it is in fact a way to get it done.
It is a way. I have used vitreous fluid to test for a substance that normally I would use urine for, and I didn't have any urine in the case, so I used the vitreous.
Now, you talked about the findings in this case in regards to the blood.
Yes.
And you stated that based on you adding the amount of the EME
Yes.
along with the cocaine, in your opinion, was the best way to come up with how much parent cocaine she would have had in her system.
Correct.
Can you explain that to us, please?
Well, like I mentioned before, there are enzymes in the blood that can break down cocaine even after someone has died, unless you get it into that tube with the sodium fluoride, which we didn't have in this case. So there was a week, 10 days in the hospital that blood, cocaine could be broken down, and then additional time before it got to the laboratory to be tested. So there was quite a long time for the cocaine to be broken down. So that's why it's important to look at both of those.
And so that we can educate the jury, the cocaine itself would be the parent cocaine, right?
Right.
The BE is the next metabolite that parent cocaine will break down to, correct?
So that is a breakdown product that is inactive, and it can build up and be there for a little while.
And then you have, from BE, it goes to EME, is that correct?
I don't think it goes in that order, but with this one, we're worried about the cocaine being broken down in the tube after death, and it gets broken down into econyl methyl ester.
And those are the 3 levels in which cocaine breaks down.
Yeah, those are the 3, the cocaine plus the 2 breakdown products.
And it's your testimony that the best way to determine from Ms. Benning about how much cocaine would have been in her system on 225 would be to add the parent cocaine with the EME. That's your testimony.
That's correct.
And the 7,878 nanograms per liter is a huge number. Will you agree with
Per
me?
milliliter. Yes, it is.
Okay. And it is too much, I think you stated, for the body to take.
Right. It can be overwhelming for the heart.
Now, you're not stating that everyone who has a level of 78 ends in death, are you?
I'm not aware of someone with that level surviving.
Okay, so it's your opinion that anyone who has that kind of level would be dead?
It's hard sometimes to interpret in some of these illicit drug levels what's a lethal dose, because you have to find out, have they been using cocaine over time? Have they developed tolerance? Maybe they can handle higher levels. In this case, she is a naive user, so for her, this is too much for her.
Now, how did you come to the conclusion she was a naive user?
The investigation did not reveal any history of cocaine use.
And who relayed that information to you? How did you come to that determination?
That was talking to the police, because they did the investigation into, anything about her.
And who specifically did you speak with in regards to that conclusion?
I believe I talked to Detective Reese, because I specifically asked him about a history of drug use.
And what did he tell you?
That she was not known to partake of cocaine.
Did he tell you cocaine or drugs, period?
This was specific to when I was asking about the cocaine.
Did you ever make a statement that you were told through the police investigation that there was no history of drug use, period?
No, I don't think I said that. Because I think in the past, there might have been some marijuana edibles.
Sorry.
I believe she may have used marijuana in the past.
So you don't think you ever said that?
Let's see. Yeah, see here it says, no history with illicit drugs other than marijuana used to make edibles. So no other illicit drug use, specifically cocaine.
Would it help you if I was to show you your testimony from the bond hearing to refresh your memory about whether or not that statement was ever made?
Sure.
And I'll put a sticky.
Okay. So if you're referring to this, I stated, the investigation does not show Ms. Benning as someone who used drugs historically or even recently close to her time of death. It doesn't appear that she used this sort of illicit drug in the past. So referring to the cocaine.
And so when you stated that it doesn't appear that she had the history of using any drugs, you're saying that you were speaking about cocaine?
Yes, because I specifically say this sort of illicit drug.
Now, can you tell me when you talked about things that you look for, when you talked about cocaine, seeing it in the past, things that were in the system, you remember talking about that?
Yes.
And did you see other things in her system that that at least would have caused you some concern or to consider?
In my testing, no.
No, and Ms. Benning's history in any of the tests?
There were several other rounds of testing that were done, but most of those, well, actually all of those were after this initial sample. So she was at the hospital and was given various medications to treat her at the hospital. So those medications showed up in that testing.
Well, specifically, you stated on direct with the marijuana, you were
Right.
looking at different things that were in there, correct? In her system.
Right.
Did you notice that cocaethylene was present in her system?
No. There's no cocaethylene in her blood.
Do you remember where there was a confirmation testing that was done on cocaethylene?
No. And there's no, the cocaethylene testing was done on the hospital blood. The reporting limit is quite low, and there was none there.
Quite low, like you talked about with the cocaine in the baby's liver?
Right. So it's,
And you testified that you noticed in the baby's liver there was cocaine, but it wasn't on the reporting level, right?
no, I asked the toxicologist if there was a presence of any, I think I asked about cocaine and I asked about marijuana. And they
Right.
said they did see some cocaine, but it was near the reporting limit.
Right, but you testified earlier that even though it wasn't in the reporting limit, it was there, it was present, and so you like to look at that in order to make a determination.
Yeah, I was interested in learning that information, yes.
That would be the same thing for cocaethylene, would it not?
Right, but I wasn't aware there was any cocaethylene there. And the reporting limit is it's very low, at 10 nanograms per milliliter.
But in the same manner that cocaine was there in the liver, the cocaethylene is present too. It's just not in the reporting, above the reporting limit.
I'm not aware that there's any cocaethylene in this blood. I was not told that at all.
Well, why would a lab do confirmation testing if cocaethylene did not show up at all?
They did confirmation test. Well, they did testing for benzoylecgonine, cocaethylene, cocaine, and ethylene methyl ester. That's what the cocaine and products panel includes. So they tested for all of that as part of that panel.
But why would a lab do confirmation testing? Because let's talk about that.
The confirmation testing that's listed here is on the liver tissue.
That's her baby, is it not?
Right.
And you just testified that what's in mama is in the baby as well, correct?
I said that the cocaine was in her
Any
at a
substance,
very low level. But I wasn't told that there was any VE or cocaethylene. We just talked about cocaine.
any substance that is in the baby can only get there if it comes through mom, is that correct?
Right. And I wasn't told that there was any cocaethylene in the baby.
Did you look at the results to see whether or not there was cocaethylene in the baby?
There's no cocaine, cocaethylene, or benzoylecgonine reported on this for the baby. I specifically called and asked the toxicologist about the presence of cocaine and was told yes.
That's not my question. I understand what was reported here. I'm asking whether or not the presence of cocaethylene was present in the baby liver at all.
I was not told there was any cocaethylene in mom or baby.
If the baby did have the presence of cocaethylene, but just not above the reportable limit, what does that mean?
I don't know what you're getting at. I asked about cocaine and I was not told there was any cocaethylene.
Right, but I'm asking a different question.
If there, so we're getting into hypotheticals now. If there was cocaine and ethylene, because there's not any. So
is your
if
te-
it was there,
So is your testimony today, there was no cocaethylene in
I'm-
Ms. Benning, if I could finish?
Sure.
And Ms. Benning and or the fetus? It's a simple question.
I'm-
Is that your testimony?
it is correct. I'm not aware of any cocaethylene in mom or baby,
If you,
either on the report or in my discussions with the toxicologist.
if you were to learn later that there was in fact cocaethylene in the baby or in mom, how would that change your evaluation?
It wouldn't.
What is cocaethylene?
Cocaethylene is formed when cocaine and ethanol or alcohol is in the blood at the same time.
And that would mean whoever has cocaethylene in their system was drinking alcohol and taking cocaine at the same time.
You want to
correct?
show her something that shows that?
And,
She says she is not aware.
well, I can show her the lab she's looking at, where it specifically states that there was a confirmation test for cocaethylene.
Okay, she's got that. Do you see?
Yes, the confirmation test was for benzoylecgonine, cocaethylene, and cocaine, and none of them came up as positives on this page.
There's a screening test that's done before a confirmation test, is it not?
Correct.
And if something doesn't show up on the screen test, then it doesn't pass on to the confirmation test. Would you agree?
Correct. Because you can have a false positive. You want to confirm it.
Right. I'm not talking about false positives. And a lab will not move from screening to confirmation unless something shows up positive, correct?
Sure.
That means that during the screening process, there was a presence of ethylene, not what the ending results end up, but there was a presence that made them move from screening to confirmation.
There was something of concern, it appears, for them to further test.
Now, let's talk about your conclusion in regards to Ms. Benning and the ingestion of cocaine.
Okay.
In order to arrive at the number of 7,878 nanograms per liters of cocaine,
Milliliter. Yes.
milliliters, I'm sorry, of cocaine, can you tell us how you believe that Ms. Benning would have had to ingest that?
When you look at the literature, it shows that you do not get these levels with all the other routes of administration. You really only get it with ingestion.
And is your testimony that ingestion from Ms. Benning would have been through a liquid cocaine?
I don't know how it was ingested. I just know it was ingested.
Would you opine that it was one bolus dose or over a period of time?
I don't know. I know from, obviously, the investigation, she doesn't have a prolonged period of symptoms.
So you believe it would have been one bolus dose more likely than not?
It could be, yes.
How much cocaine is 7,878 nanograms per milliliters? Could you give us an example of equating what we would look, an apple, an orange, a lemon?
So, unfortunately, with illicit drugs, there's no quality control or testing process like you have with your normal medication that you buy over the counter or from the pharmacy, so it's in a tablet dose and you know exactly how much it is. I have no way of knowing how much powder or liquid or how pure it was. I can't give you any specific size or amount.
But you'll agree with me it would be a whole lot, right?
If it's a very concentrated dose, it might not be like a large size of something.
So it could be very small.
It could be.
And then if it's very small, it could be something someone took on their own. Could it not?
It's possible.
Will you agree with me that most overdoses are a result of an accidental overdose?
Yes.
And in our hypothetical just previous that we talked about that because of the concentration, it could be very small, then it also could be an accidental overdose of someone who took a small dose.
You mean like a small amount that turned out to be more than they thought?
Like we just talked about, yes, ma'am.
Yes.
You're stating today that you've never seen prior to this dose or this case doses of that amount of cocaine.
Yeah, I only found the one.
Okay, so there was one you've seen before.
There was one, yes.
Okay, just making sure. Let's talk a little bit about the heart cells.
Okay.
Ms. Benning had enlarged heart cells, not major, but they were a little larger than normal, were they not?
Correct. She had focal myocyte hypertrophy in the left ventricle.
Okay, and what does that mean?
It's a small focus where the heart cells are a little bit bigger than normal.
And an occasional, hypothetically, an occasional cocaine user would have enlarged heart cells similar to what you described, would they not?
You know, I'm not sure about that. I've seen chronic cocaine users who have developed high blood pressure and thickened left ventricles, but I don't know about the occasional, if it affects the cells on the, it's possible.
It is possible.
It's possible.
Now, did you learn at some point that Ms. Benning tested positive also for fentanyl?
Yes.
And you familiar with the opioid crisis in our country today?
Yes.
Objection, Your Honor, to the relevance.
What's your next question?
And you'll agree with me specifically during this time that Nashville itself had an issue with fentanyl overdosing.
Objection, Your Honor, to the relevance.
Do you care to be heard?
Yes, this goes to our defensive theory, Your Honor.
Do you have any studies that show in Nashville how many fentanyl overdoses there were?
I don't have them handy, but it's definitely been on the rise over the last several years and has been followed.
And there is currently an issue with what they call a fourth wave of the opioid crisis, where there's a mix of fentanyl and a psychostimulant such as cocaine. Would you agree with that?
Yes. Fentanyl is often mixed with other drugs.
And that would be something similar and analogous to exactly, well, let me back that up. If someone was to overdose on fentanyl and cocaine, that would be consistent with the current rave of the opioid crisis today.
Yes.
Given that Ms. Benning had fentanyl as well as cocaine in her system,
Objection, Your Honor. Counsel is mischaracterizing.
Is what?
She's mischaracterizing.
Okay. Do you want to ask her where that came from her opinion?
no, I wanted to ask her whether or not,
You can do whatever redirect you want. What is your question?
if Ms. Benning had fentanyl and cocaine in her system, certainly that fentanyl could have contributed to her death, couldn't it?
It could. However, the fentanyl that I've learned about that was found in that testing was after she was given fentanyl at the hospital in course of her treatment.
Were you aware that she tested positive for fentanyl prior to being administered fentanyl in the hospital?
Objection, Your Honor. Counsel is misstating the evidence.
Your Honor, no, I'm not.
Can you help them understand when it was given? And
So fentanyl was ordered at the hospital and was given to her. And I believe there's been a lot of work to clarify the blood samples, but the blood sample that is positive for fentanyl is after she was given fentanyl at the hospital.
okay.
Are you aware that at 22:59, that there was a urine sample that tested positive for fentanyl from Ms. Benning? Are you aware of that?
And again, objection, Your Honor. Counsel is misstating
Okay.
evidence.
Dr. Olashuga testified all negative in urine results from 2259.
Your Honor, we have direct evidence, and I'm
Okay,
asking
well,
her.
we haven't gotten there. I mean, they're objecting to your question is not accurate. So whatever proof you want to put on that it's not, then that's fine.
Hypothetically, if Ms. Benning tested positive for fentanyl prior to being administered fentanyl in the hospital, would that affect your decision as to what could have caused her death?
I would want to know what the level was, and we can look at, whether or not it's fentanyl and cocaine causing her death. But everything that I've found, that urine drug screen that was positive for fentanyl was also positive for an anti-seizure medication that was given at the hospital. So I believe that fentanyl is administered by the doctors treating her, not illicit drug.
I understand that. Are you aware of the metabolite 4-ANPP?
Yes.
And would you agree with me that that's more in tune with illicit use as opposed to a medical use?
It has been in the past, but apparently that has now come up positive in fentanyl that is administered by a hospital, or by a doctor. So it doesn't really carry a lot of weight with me anymore.
But it used to carry a lot.
It used to, but not anymore. And I know that was negative for acetylfentanyl, which was also tested and is more in illicit drugs.
I'm not asking about acetylfentanyl. I'm
Okay.
asking about 4-ANPP.
Well, I use that to kind of help in that determination.
I understand.
Sure.
I'm speaking of 4-ANPP.
Mm-hmm.
There was a time where that was important to you, right?
Right.
And it was indicative of illicit use, was it not?
Yes.
And so, if Ms. Benning hypothetically tested positive for 4-ANPP prior to you changing your thought process on it, it would make you believe that there was illicit use, correct?
Possibly.
And can you tell us what are some of the symptoms of a fentanyl overdose?
So whereas cocaine is a stimulant, fentanyl is a depressant. So it's more like alcohol, where everything slows down. You know, the breathing slows, the heart rate slows, and they tend to get very sleepy and then go to sleep and don't wake up. They can also have issues with edema in their lungs, where you get kind of the fluid that's getting out into the air spaces, and so they might have like the foamy fluid in their mouth and their airways.
Okay, so you expect to see some foam around the mouth?
Possibly, yeah.
You expect for that person to become sluggish?
Yes,
Depression of the heart rate?
yes,
Something consistent with the baby, the fetus's heart rate going down to 30? Would that be consistent with a slower heart rate?
yes.
Someone then going to sleep, as you just stated?
Mm-hmm.
And with fentanyl overdose, that happens much quicker than a cocaine overdose. Would you agree?
No,
No? Well, could it happen quickly?
could.
So if someone is snapping pictures and taking selfies, and within a minute they have slipped into a medical episode that is described as becoming sluggish, foaming at the mouth, labored breathing, lower heart rate, would those be things that could possibly be consistent with a fentanyl overdose?
It's possible.
And to be clear, as it relates to Ms. Benning's OBGYN history, there was no testing done by her OBGYN to determine whether or not she had the presence of drugs in her system, correct?
I don't recall seeing that. Yeah.
So we don't know.
I don't think there was drug testing.
If you were to learn that Ms. Benning met with her drug seller or person she received drugs from on that day, February 25th of 23, would that weigh into your consideration?
I mean, it's a piece of information that's good to know, but it still doesn't change what's in the blood.
Thank you.
Any redirect?
Yes, Your Honor.
Dr. Carney, Ms. Hollins just asked you a lot of hypothetical questions, beginning with fingernail clippings and whether or not you sent those off for drug testing. Was there any evidence that Ms. Benning ingested cocaine by snorting it?
No,
Was there evidence to the contrary that she ingested it by swallowing it in liquid form?
it's definitely consistent with the ingestion.
And she was specifically asking you about other drugs that Ms. Benning might have used. Did any of the testing reveal anything when Ms. Benning first went to the hospital other than cocaine?
No,
There's no alcohol, there's no marijuana, there's no nothing. Is that correct?
that's correct.
And she asked you a lot of questions about cocoethylene.
Yes.
Is there any evidence whatsoever that Ms. Benning was drinking alcohol and snorting cocaine?
No.
And is there very specific evidence to the contrary?
It appears so, yes, from the investigation of the scene.
If she had been drinking alcohol, would that have shown up in testing?
Yes.
And did it?
No.
And if she had been using any other drugs, would that have shown up in testing?
Yes.
She asked a lot of questions about fentanyl and a fentanyl crisis and opioid crisis. Dr. Carney, is there any evidence whatsoever that fentanyl was ingested by Ms. Benning when the dose of cocaine was ingested?
No.
And specifically to that dose of cocaine, can you say exactly how much it was?
Like
What amount?
size-wise?
Yes. In the other case where the amount was 10,000 nanograms per milliliter, the circumstances of that person was in police custody, is that correct?
That's correct.
were you provided with like the facts of that case as part of the autopsy?
Yes.
And was it a large amount of cocaine?
It would have had to have been something he had with him that he could swallow quickly.
And so something that you could have a small rock, pop it in your mouth, swallow it, and that would do it.
Yes.
Thank you.
You have other questions?
I do,
Okay, just a few?
yes.
Okay.
Dr. Carney, what drugs did you test for?
I tested for cocaine and products as well as designer opioids.
What is included in designer opioids?
It's on the 3rd page of the report, and it's a lot of these designer fentanyls, and it includes 4A and PP.
Now, you just stated that there's no evidence whatsoever of the presence of cocaethylene in Ms. Benning. Is that what you testified to?
I have no positive findings for cocaethylene and no communication to say otherwise.
Are you familiar with the lab of the Center for Forensic Science, Research and Education?
Yes.
Okay. And that's a lab here in Nashville?
Actually, the CSFRE is a branch of NMS labs.
Okay.
They're associated with NMS.
Is it a lab that is utilized by Vanderbilt?
If they send their samples to NMS labs, yes.
And are you aware that there was a sample of Ms. Benning's blood that was sent to CSFRE?
Yes.
Did you have a chance to look at the results of those testings?
Let's see. I have some testing here. I think it was urine, actually, that I was aware was
sorry.
sent.
Yes,
Yeah,
the urine.
urine was sent to the research lab, yes.
And in fact, isn't it true, Dr. Carney, that her urine tested positive for cocaethylene at the CFSRE?
I was not aware of any cocaethylene, no.
If I may, Your Honor, if I can show the witness. Can you please take a look at those results?
Okay. Okay.
Do you see there where Ms. Benning tested positive for cocaethylene?
I do see a positive for cocaethylene here.
So the statement, conclusion, or testimony that there is nothing, nowhere else to suggest Ms. Benning tested positive for cocaethylene isn't true, is it?
There's a positive here in the urine.
And so if it's positive for her urine, that means at some point, Ms. Benning had to consume alcohol and cocaine at the very same time.
It's a product of cocaine and ethanol. So yes,
No
there's some
other-
sort of ethanol there.
No other way around that, is it?
No.
I'll pass the witness.
Any other questions?
Dr. Carney, there were only 2 samples that were obtained from Ms. Benning, a urine sample and a blood sample, prior to her receiving treatment at the UMC. Is that correct?
I believe that is, well, let's see. I know the blood sample is prior to. The urine here, if this is the first urine sample, it's positive for drugs that she was given as part of her treatment.
It is not the first urine sample.
Okay.
That is the purpose of my question.
Okay.
If this urine sample is after she received medical
Which
treatment.
one are you talking about?
I'm referring to the report that Ms. Hollins just
Okay,
gave
from
handed
the other
her.
lab.
Right.
Okay, what's your question?
Ms. Hollins was asking questions like that was a urine sample that was taken in the beginning. If that urine sample is from after Ms. Benning received treatment,
Right.
there's a positive for cocaethylene, but there's also a positive for fentanyl type products, correct?
Correct.
And that is consistent. I guess, can you describe it? Are all of those substances consistent with her receiving medical treatment at Vanderbilt Hospital?
Yes, so there's the cocaine and the ones that are associated with cocaine, and then one positive cocaethylene, and then everything else looks like it was from his or her treatment.
And are you familiar with CFSRE labs?
Yes, I'm familiar with them.
And do they do kind of specialty testing?
Yes.
And their levels are lower than other labs, correct?
I would not be surprised, considering there's not even a number on here. It's just a positive.
And I guess the toxicologist that performed this test might have more information about that level and why that finding was there.
Yes.
You reviewed multiple results of lab work related to Ms. Benning. Was cocaethylene in anything else?
No.
Thank you.
Any other questions?
Yes. You're not telling this jury that Vanderbilt gave her alcohol and cocaine, are you?
No.
Okay. So regardless of when the urine was taken, she had it in her system, didn't she?
There's a positive there. I don't know what level, but
And if the original urine that was taken from Miss Benning was notated at 2259 on 225, and her first administration of fentanyl was not until after midnight that night, that means that that urine testing was prior to her getting fentanyl. Would you agree?
so she had a seizure disorder? Because she has an anti-seizure drug in here that was given at the hospital.
I'm not talking about seizures.
Then I don't think that we can say that this is prior to treatment. This is after treatment. She very clearly has other drugs in here that were from treatment.
I don't think you're hitting my question. I'm not speaking
Objection,
about
Your Honor, it's been asked and answered.
Okay, what is your question?
My question is, if her urine was taken at 10:59 p.m. from Vanderbilt, and fentanyl was not administered until after midnight, if that urine tested positive for fentanyl, that would
Objection,
be...
Your Honor. Counsel is misstating the evidence. That report
No,
is
I'm
not
not.
related to that sample.
She can just answer the question. The evidence is going to come out
Did
as
you
it
have
is.
multiple urine samples?
So there are urine samples, and they're clearly after she's received treatment. And I believe this has been all worked out as far as the timing. So the fentanyl from this is from her treatment.
And you're right, it has been worked out.
Right.
Because
So this is
originally-
not illicit fentanyl.
What
This
is
is
your
treatment fentanyl.
Originally, up until as late as a few...
Objection, Your
What
Honor.
is your question?
Counsel
I would like
is
to stop
misstating
you
the
from asking.
evidence.
I can't answer. I can't ask.
What is your question?
For the first year and a half to 2
You gotta
years,
start out with that. What is your question?
the original urine, was it not? It was taken at 22:59. Is that correct?
That's what it states.
Okay, that's all I needed to know. And fentanyl wasn't given until after midnight. Isn't that right?
I don't know that that's accurate.
Did you take a look at the records?
I did, but there's been a lot of examination of those records.
And so have they changed?
I can clearly see that she's been given treatment, and fentanyl was part of her treatment. It was ordered almost very early on when she was there. So my understanding from everything that I've reviewed is the fentanyl that's there is from treatment and was not illicit, and I did not include it as a cause of death.
I know that, but my question was, the first round of fentanyl wasn't given until after midnight. Isn't that true?
I don't know that that's accurate, no. And actually, if it was given after midnight, then this urine was taken after that. It was taken after she was given fentanyl.
But if the original urine that was notated at 10:59 p.m., that would be before, wouldn't it?
It would, but I don't think that that's accurate.
Any other questions? Any other questions? All right. Next, we may step down and just leave those items